All right. Good morning, good afternoon, good evening. I am Ann Wilson, reporting live. No, just kidding. Welcome to our alumni of Rizal Youth Leadership Institute, Rizal Talks. And one of our topic for this Rizal Talks, the first one would be digital healthcare, the new way of healthcare delivery. So we are just waiting for some viewers. And while waiting, again, thank you to those who already subscribed to our channels, for liking our pages in Facebook and in YouTube. Thank you very much. So let me just see. Hi, John Dave. How are you? Good evening.
Hi, Anne. I know it's too early for where you are.
Yes. Coffee, coffee.
How
Yes,
are you?
coffee,
I hope
coffee.
the family is safe.
You are safe?
Hi, Anne. I
Oh,
know it's too early
wait up.
for where you
Why?
are.
Yeah, I'm hearing an echo. Oh my goodness. I muted myself. Hello?
I could
My
hear
test.
you.
Wait up. Why? Okay, it's just annoying that I could hear the. Okay. All right. So, how are you? I know you are quarantining right now. Tell us
Yeah.
more about that because, our viewers might not know that. I know you told us about that earlier this morning on our first live. So, how are you? I know you are quarantining right now.
Hold on. Is it me or there's a
I do not
feedback?
know. I know, right? So, which one are you hearing me? I don't know.
I'm hearing you on the actual, but it seemed like I don't
Oh,
know.
you know what?
I think it's a
Facebook.
YouTube or Facebook. Yeah.
Yes. So, are you also in Facebook or YouTube?
No, I'm just in StreamYard.
Yeah, we have to turn off our Facebook maybe or
Yeah, I
YouTube.
think.
Is
Yep.
it me or that one? Let me just make sure that I am not in both. Oh my gosh, that's anyway. I can still hear it though. Is it on your end, John Dave?
No, because apparently I closed down everything.
Oh no, me too. But that is so funny.
I know. It seemed like there's
Oh,
somewhere that's.
oh, you know what? It's my phone.
Oh, there you go.
I was like, how come I can hear it? I'm closing everything. So I'm making sure that we are live in Facebook, but then I'm also hearing
Okay.
everything on Facebook from my phone.
Okay.
Funny, funny, funny. All right. So again, John Dave, how are you and why are you quarantining?
Okay. The story started in the 18th of December. I had to leave the country because I have to show up to Harvard. I got into executive education for Harvard Business School. For it's more of strategy for healthcare delivery. And then I went back home the 15th of January. I arrived in Manila on the 16th. But I think a week prior to my flight of going back home, US was identified as one of those 34 countries that had the second strain of the COVID-19 or the UK strain. So basically, there's a travel ban for U.S. nationals to come in to fly into the Philippines. The only people that are allowed to come in are actually Filipino citizens, and then those that got coming from big NGOs like WHO, UN, and even the dignitaries. So as soon as you land in Manila, you have to undergo the strict 14-day quarantine. And even if you would have your swab test yield the negative test result.
Oh, okay.
So, so
So it's
basically, I'm on my six, yeah, six. No, no, I'm on my seventh day.
oh my goodness. So you still have one more week to
I
go. Oh,
know.
we can have the most of you in 7 days. Because I know when you're back to the real world, you will be very busy. We could not catch you. You will be flying, well, not flying, running around everywhere. But I
Yeah,
mean, I'm happy you're safe. Everything is negative. I just, that caught me. So only Filipino citizens can now go back to the Philippines. Is that correct?
yeah. Only Filipino citizens, those that are coming from the travel restricted countries, or in the United States of America is one of them.
Mm.
Only Filipino citizens, only those that are diplomats and coming from big NGOs like WHO and United Nations. And then if you come in, you have to go through the 14-day quarantine.
Yeah, that's something new for me because last December I knew a friend that went home and had all these other travel restrictions. So it's really changing, and it's good to know the updated one because she was already in she was already in the airport and she was asked for a visa and she was like, "What visa? So all that other stuff." Anyways, that's a different story. But yeah, again, I'm just so happy that you're safe. You have a negative result, and that's one thing that's important. You have to be safe when you go back to your
Yeah.
family. And thank you so much for taking your time to agree to, share your knowledge on digital healthcare. So, again, as what I've said earlier, when you say digital healthcare, healthcare itself, it's already a challenge in the Philippines. Believe it or
Oh,
not, we already know that. And why are we speaking in our language? Who are our viewers? If they can just say something, or well, we can also do that. Pero nahihirapan talaga akong mag-Tagalog, guys. Kaya yung mga nandito nga sabi, "Bakit ka na English, Bisaya ay ano naman, Tagalog naman yung kausap mo." Is mahirap talaga 'pag nagtatagalog. But magta-try ako. I will try my best. Yeah, um, mahirap na nga ang sitwasyon ng healthcare sa Pilipinas. Gagawin pa nating digital. Paano yun, Jen Dave? Like, give us a background about yourself and what are your views on this and research-wise. Convince us, what is it about the digital healthcare that we need to open our eyes na kailangan nating malaman? Like, this would be new kung ako hindi ko alam, ay, pwede palang ganyan. So, ano yung mga bago or pwede nating improve sa ating healthcare sa Pilipinas?
okay. I think, Anne, before anything else, I would
Mhm.
want to, of course, thank you and Miss O and Ram and everybody in Arile. Um, it's been a while. It's been a while since I've had a chance to talk to you guys. It's been a
Mhm.
while since I remember during, I mean, how would I say this? Hey, years that we had during the student activism time. That's how we get to, laugh at each other and then, share ideals. I remember I was in New York. I had a chance to, spend time with Miss O and then in her family. And
Mhm.
it's pretty much a good chance to always get together and get this kind of opportunity also to share what we have been through, or, what we have pursued. When you talk about healthcare, it encompasses a very big spectrum of stakeholders. You're talking about, a patient. You're talking about ambulance driver. You're talking about nurse. You're talking about physical therapist. You're talking
Mhm.
about medical technologists. You're talking about, doctors, specialists, consultants, residents. I mean, it goes with the entire shebang. And you're right.
Anything health-wise, yes.
Exactly. And
Mhm.
and you said it right. When you talk about healthcare in the Philippines, it is actually an industry that we shy away from, because when you talk about healthcare, it's more of, it's either it's the end of the road or it's going to cost you so much.
Mhm.
Meaning, we talk about cost, we talk about, time. You go to a doctor, you had to make pila for like 3 hours before the doctor would get to see you. And that is, I mean, trust me, it's pretty much how the spectrum of healthcare delivery is in the country. And then when you talk about ratio of a doctor to a patient,
Mhm.
if you get like a good doctor, there
Mhm.
would be 50 of you in queue to meet the doctor. At times, you wait for like 3 hours to be able
Mhm.
to talk to the doctor for 15 minutes, and then
Mhm.
you go out, you pay 500 pesos, and that's it. So
Mhm.
basically, for us, we take it into consideration in a way na parang, shucks, do I really have to go to the hassle of, meeting my
Yes,
doctor? Um,
true.
the very ideals of understanding healthcare actually is more of, in the Philippines, I don't believe that it's healthcare. It's actually sick care.
Sick care. All
Yes.
right.
You know why? You get to visit your doctor when you're sick.
Correct. I
You
agree.
get you get to do your executive checkup when you are sick.
Yes, there's no preventative measures in the Philippines.
Exactly.
And that's
So
one more thing also because we don't have money. Why would I go to the hospital if I'm healthy? I don't
well,
need. go to the hospital if I'm healthy. I feel healthy. I don't have to go get checked up. Right.
And that basically plays a vital role in terms of how have we become as a player in the healthcare industry. We've been too passive.
Mm-hmm.
We've been thinking that, I don't feel sick. You're right. I don't feel like mulingin ako. And how would I say this? Medyo nahihilo ako. I'm just going to take biogesic, or masakit ang ulo ko. I'll just take
Not
Advil and I'm
sponsored.
good.
Not sponsored. Not sponsored.
Yeah.
Yes.
Sorry nga pala. So
Yeah.
it's
It's
just really
okay.
more of, it's more of, we always get into that kind of notion na parang nakaya ko to. It will be too expensive for me to visit a doctor. It'll be too hassle for me to, be on queue.
Mm-hmm.
It's going to be entailing a lot of work for me to drive myself, or get a cab, or take a jeepney going to a hospital. Or parang you go to a laboratory and do a blood drone, or get your complete blood count test, and we don't give, I mean, pardon my French, but we don't give an S in terms of, why do we have to know laboratories? Why do we have to know, like, how's my physiological made up is? Why
Yes.
do we have to be very serious about my blood pressure
Yes.
shooting up? I mean, if I could still breathe, I'm okay.
Right. Correct.
Basically, it's a misconception. It's a misconception that at times preventive care is more reasonable
Right.
compared to corrective care.
Right.
When you
Correct.
when you say corrective care, it's more like,
Yeah.
mataas na pala yung cholesterol mo, one snap of a finger, you're going to have aneurysm. It's going to be very costly.
Yes.
You're going to have, an operation on your brain, or
Mhm. That's
worst part
why
is
mas
your,
marami tayong nasa-shock sa Pilipinas na, "Uy, namatay na lang si ganito, ganyan-ganyan." Bakit
exactly.
hindi nila alam? Kasi po, stage 4 na, stage 5 na nung nalaman kasi nga, we don't have that. And before we continue, John Dave, please help me welcome our ARYLI founder, Miss Olive is here. Good morning.
Sure.
Good evening.
Good
There.
morning, John Dave and Anne Marie. You're doing a great job here. I really love your discussion. I've been listening, and guys, you have a point. So keep going.
Okay, okay.
Yeah, so to continue that, I agree, and I only knew that, of course, as I was saying, I have been living here in the U.S. for 12 years. It's very important. We always have our yearly checkup, even with the teeth. If you don't, if like, let me just give you a background. Bakit ang 34, 37 years old naka-brace? It's because we, even with teeth, that's part of healthcare. And I just realized that even if it's expensive, and I am just realizing that now, that that's part of my health and I have to correct that. Back then in the Philippines, hindi tayo pumupunta sa mga dentist kung wala na tayong, well, ako kasi I did not grow up, well off. So, ang pagpupunta sa dentist kahit nga kung kailangan lang may bunutin. And it's so sad that nabunot yung ipin na parang we could have saved that. That's a very
Exactly.
small thing to think, ha? Pero ay kasi pag masakit na, so hindi na maaagapan. Pero dito sa Amerika, nag-i-implant pa nga, it costs thousands and thousands. Kasi nga, andito sa Amerika, binavalue natin yan. Pero babalik din tayo sa pera talaga dyan, Dave. We will go back to like, wala kasi. And I experienced that queuing. Even sa lola ko nung 2016, I went home. So I really took, because she had a stroke, na? So I really took care of driving her to the doctor, to the specialist. We had an appointment at 6 o'clock. Siya lang ha, may appointment. What time kami nakita or 9 o'clock na, but the appointment is 6 o'clock. Hindi pwede yun. Kaya nga tinawag na appointment. Ang sakit ng ulo ko doon, not just waiting in the nasa corridor pa kami sa labas. Pero, oh my gosh, what do you call that an appointment for if hindi nyo kami makikita ng 9 o'clock? I mean, 6 o'clock. You said 6 o'clock. You know what I mean? So, those are simple things na I agree we need to open our eyes into. And posible ba talaga yan dyan, Dave? So, one, we are talking about this, we're exposing this, that is possible in other countries and it's happening in other countries. Why do you think Filipinos are having a hard time moving forward with that kind of healthcare, of not just sick care?
I think just for a disclaimer, later on I prepared like I think 7 slides that we could go through,
Okay.
and then there's a small videos or snippet of videos lang that I would want everybody to also get a chance to hear too. Um,
Mhm.
in the Philippine setting, Manggod,
Mhm.
when you talk about money, we always talk about survival. So it would always
Mhm.
have to go into the basic necessities:
Mhm. Right.
food, clothing, and shelter. And then we never thought about health as part of the necessities.
Mhm.
Normally, we always think about healthcare as, parang meron pang adage nun na parang pag nagkasakit kang cancer or, a terminal illness,
Yes.
it's sakit ng mayaman. I mean, I don't know. I've heard that. Honestly, I've heard that from my family. I've heard that from my aunts. I've heard that
Kasi nga
from my mom.
na-diagnose ka. Kasi 'pag sa Pilipinas
Exactly.
kung nasa bukid ka lang tapos hindi alam na cancer na pala yung ikinamatay mo. Tama
Yes.
ba? Or, kung
Yes.
nag-disagree kayo, you can write it in the comment below.
Because
Ayan.
we always value pamutbut, we always value surhano, we always value pahilot. These are the concepts of how
Yes.
our, folks brought us with that kind of notion.
Right.
I got into healthcare because in 2016 I went back home to Bacolod.
Mhm.
And then I said there's something wrong because I was so used to, going to the US in terms of having medical care professionals take care of you,
Right.
go to the Middle East, and then you go to Makati. At some point also it's like a highly urbanized city. So you
Mhm.
get the kind of care or the kind of attention that you deserve. But in
Correct.
Bacolod, it's more like you go to a hospital, you get to see a lot of people queuing, and then it's ano, I'm not trying to undermine the practice, but it is always a practice that when you go to emergency room, you have to go through a triage. So it's
Mhm.
more of if you're not a 50-50 case, then you
Yes.
are on queue.
Well,
If you're
alam
a
nating
50-50
lahat
case,
'yan. Hindi 'yan
yeah,
madi-deny, that's a fact. So, mabe-verify natin 'yan. Yes, that's a fact. Yes, correct.
yes. The problem though is that aside from triage, Anne,
Mhm.
there is a very big demand for medical care professionals.
True.
There
I
is a
Yep.
2017 there was a white paper that was done by PricewaterhouseCooper, and then they studied the market for emerging markets. It focused on Asia, and then what was very alarming during the time, it was 2017. This was pre-pandemic.
Mhm.
Um, 2035, that will be 15 years from now, or 16 years, no, 17 years, when I had a chance to read the white paper, the
Mhm.
Philippines will be experiencing a 1.1 million deficit of hospital beds.
Ooh.
1.1 million deficit.
Mm.
And 2035, we are going to experience a 1.2 million deficit of medical care professionals.
Right.
Yeah.
And that's like what? 17 years prior to 2035, I don't think we'd be able to create or, build hospitals to address that gap.
Right.
And I don't think we would be able to, create or develop medical care professionals, even if we have the best medical schools, that
Yeah.
kind of number to close the gap.
Yeah,
Um,
I guess this is just a very timely discussion. So, if we can bring about the youth to watch this again, a lot of our youth, and it is, I would say, embedded in our culture, they take up healthcare professions not to stay in the Philippines, but
exactly.
rather to find opportunity to leave the Philippines. So, um, I was just, posting our talk, and I was saying that, guys, join us because the youth of yesterday is now changing the future of the youth of tomorrow, the today's youth for tomorrow. So, let's bring about, the fact that even though John Dave, you're bringing this news because the healthcare system in the Philippines is about to change, and there are a lot of people working who are behind the curtain to change the way it is right now. I think what we need to understand also as a country is that we are going against the force of our culture. Like you guys were mentioning, would rather be going to the quack doctor or the manghihilot. It's because that is embedded in our culture. And aside from the fact that, and Anne has mentioned, it's a question of, do you have the budget? Do you have the money to go and pay? Again, the quack doctor, the manghihilot, is more convenient and accessible. So I think it's not just about education, but accessibility. Do we have access to the healthcare centers? Do we have access to the care? And also the culture. I don't think the grandma would ever say go to the doctor. The grandma would say, "Oh, adto sa manghihilot ano mo adto man
Yeah.
kanang doktor niya. Inig adto dito taas kayo ang linya." And then that's one thing that we are going up against. And the second one is the culture, the thinking of, okay, take up nursing so you can leave the country and, find job elsewhere. And really, seriously, taking up medicine in the Philippines is very expensive,
Oh
just
yeah.
like in the US. So we're gonna have that deficit, and we're gonna be ready for that unless right now the parents of right now and the government itself will provide a lot of scholarships and opportunities for the youth to really pursue a degree in healthcare. And another thing that I have been thinking while you were talking is that the salary of the healthcare workers in the Philippines is not attractive at all.
Mm-mm.
Like if you would make a youth stand side by side right now, and no stand in front of choices and options, becoming a teacher or a police officer is more attractive than becoming a healthcare. With all honesty, I think the people who are in the Philippines right now who would choose to be a nurse or a PT and an OT and would decide in the Philippines, I think they have more passion to serve. They have more love than us teachers. Okay, when it comes to serving the community, because doing a job as a PT or a nurse in the Philippines does not pay as much as being a teacher or a police officer. So that's basically what we are up against when it comes to the healthcare system in the Philippines.
That's right. Again, we have mentioned all the challenges. These are all the facts. These are all of these. But we can only do as much. And I am so glad and happy and proud that John Dave right here saw something. There was a problem back in 2016. Let me do my part. What can I do? And that's the kind of youth. We are still youth. That's the kind of youth that we built on something strong when we were growing up and say, I could not just watch this. I could not just,
Yeah.
well, in my end in
Exactly.
2016, well, I was waiting for my Lola in line and I'm just so mad. I couldn't do anything. I honestly feel like I was just pinpointing, kasalanan ni ganito, ang ganito, sino yung presidente, sino yung ano, asan ba yung staff dito, ganyan, ganyan. Because I don't know if I have enough skills to know what I'm gonna do, or I'm hopeless. I'm helpless. I don't know what to do. There's no system. Eto na, given na to. So I am just, ay, okay, next week na naman, ganito na naman ang mangyayari. But John Dave, I'm so proud of you that you have come up with something. And you mentioned you have a couple of slides to show us.
Yeah.
Maybe we can start from there and we can
Yeah.
discuss also. So I guess on the bottom of your screen, you can see share screen and I can just, yeah, I can just put it up. So I
Uh,
hope we have our friends sharing our live stream. Thank you very much. Rachel, please share our live stream. When there's 10 of us in there. Oh, I don't know why I'm feedbacking again. I know I don't have my live on my phone,
can
but
you
here
can
we
you
go.
yeah, can you see my screen?
Yes, sir.
We can
Okay.
see it now.
Okay,
Okay,
Yes.
good. Okay, so
take it away.
basically
Take it away.
we talked about the premise, quite a short history of how we look at healthcare, where is the current healthcare in the Philippines, and the challenges, which honestly, I'm very passionate about when you talk about healthcare. That basically at times it takes me like 4 to 5 hours when I sit down with the board of directors of a certain hospital when we're trying to like get inside and then try to change the way they do things, or try to elicit innovation. And I hope you guys could just bear with us on this time. So when we talk about the premise of healthcare in the Philippines, I would be more now talking about at first, how do we now link digital transformation to healthcare? And Anne and Miss O, you have to advise if you could hear lang the video.
Okay. What is digital transformation? I could hear it. We are currently undergoing a once-in-a-lifetime technology shift that will transform every industry and every business in the world. This megatrend is called digital transformation. It is evolving at a pace that none of us have ever experienced. And this is just the beginning. The first step in the digital transformation process is fundamentally changing the way you think about your business today. It involves shifting your investments from older technologies and business strategies to investing in new, innovative business models based on the latest and emerging technologies. Digital transformation is a necessity to stay competitive, and you need to address these changes before your competitors do, or you'll be in hot water. Digital transformation will have a big impact on your business. You'll make more money, recruit the best people, improve team productivity, beat your competition, create happier customers and partners, and best of all, you'll have more time for fun.
So basically, the premise of digital healthcare is just more of talking about digital transformation in the healthcare industry. So we talk about issues before of the accessibility of services. How is the public having that kind of notion in terms of trying to acquire a service, and on the premise of changing the way we do business in healthcare, and whether we like it or not, guys, healthcare is a business, and we have to put that out there so that we all would be on the same page when we're trying to understand it. Digital transformation basically is founded on four basic principles, and we call it the SMAC principle. It's not the SM Advantage card. It's more of SMAC is a principle when we try to do a digital transformation of how we do business. Digital transformation is actually known as the Industrial Revolution 2.0. So we are in the age. We started with www dot, and now we're actually more of changing things the way we do it. It focuses mainly on the social aspect of doing things. It becomes too accessible for both parties. It becomes mobile, so whether where we are, we could deal with business or do business. We now look at analytics. We don't depend so much on our gut feel. So we basically look at data on how we would be able to move around or position our product or position our services. And then the fourth one is cloud. So basically, wherever we go, as long as we are connected to the internet, that basically is how it runs. So SMAC, this is a very outdated data though, that basically started in 2014. 76% of the businesses are using social media for business objectives and to increase their return of investment every year. So I think Miss O and Anne, you would agree to this, that before, when we go to a hotel, we always think of how many stars will that hotel have. Do you agree?
Yes.
Yes.
Diba? But before, it's more of like, yeah, it's a 4-star hotel, I'm gonna use that. So it's a 5-star hotel for sure. The services, the amenities would be perfect. Right now, when you go to the hotel, you go to the website, or we call it the aggregators. You go to Traveloka, you go to, what's the other one?
Kayak.
Expedia. Expedia. What's the first part of that site would you want to look at?
Reviews.
Exactly.
Right, true.
We do not think about if they're 4 stars or 5 stars. We're thinking about reviews because now it becomes too relatable.
Right.
So you don't trust those people who establish standards, but you trust those people who went there and experienced it. So that basically is the first ruling of digital transformation. Everything became too social. It became a small world that, instead of me looking at how many stars, I'm going to look at the reviews. Second one is mobile. Before, you have to call for you to book your hotel. Right now, it's more like, okay, let me first look at my Traveloka or Expedia. There's an available one. I'm going to book it. I could even pay it online. So that basically changed it. Those two factors are actually one of the four major factors as to why digital transformation is changing the way we do things. And the funny thing is, we were discussing about it earlier, how our culture changed the way we look at healthcare, how our, our moms, our aunts, our
Mm-hmm.
grandparents would look at healthcare. But basically, because of digital transformation, everything also has changed. And for example, I'm going to talk about your lola who suffered stroke, and I'm sorry about that story, but I would want to jump onto that. If you don't have any doctors or specialists that you would want, whom you would want to, service your lola, what was the first thing that you're going to do?
If I did not have a specialist,
Mm-hmm.
Mm-hmm.
or if I did not have money to pay for the specialist.
So let's first talk about the specialist, because the first thing you're going to do, I need to see a doctor,
Mm-hmm.
right?
Well, if I did not have a specialist back then, she would
Mm-hmm.
just be the doctor in the hospital, like, or
But would you not ask for like referral from your friends?
oh yeah, of course, yeah, yeah, yeah.
So it's more of the way we do it has actually changed to these four basic foundations of digital transformation.
Okay,
Wait,
yeah,
I will
okay,
answer that because
yeah.
I was
Uh-huh.
thinking also, I would have posted it in Facebook and I would have
And
asked, guys, do
Right,
you
yeah,
know
yeah.
any,
crowdsourcing.
Yes,
cardio
yes, yes.
doctor, surgeon, something? I would have done that.
Right,
So
right,
that basically is a crowdsourcing. It's more like you wanted to look at your network in terms of who could give you a referral.
right.
Whereas
Mm-hmm.
if we were doing it before, we would now go to the hospital and look for the available doctors that could who could accommodate us.
Mm-hmm.
We will not be thinking of referrals. We will not be thinking in terms of um
Crowdsourcing.
yes, crowdsourcing. And
Mm-hmm.
then the next one, Anne, I would go back to your point, was more of, will I have the money to pay for it? The next one that you're going
Mm-hmm.
to ask is, who could refer me to this doctor? And then if there's a person that,
How
oy,
much?
I know this, your next question would be, tagpila man na siya.
Correct.
So basically,
Not
everything
a
that we
discount,
do,
Ana.
exactly. Pwede sa panghiwa sa kubi, or pwede bang
Oo
ka
ka
na
na. Mm-mm.
i-serve lang sa amin niya, pero mag-agree lang tag payment terms on the side. So
Mm.
basically, if we're going to look at it, that has changed the way we were doing things. And that was actually affecting the way we do it in the business of healthcare. Now, I will not really dig deeper in the digital transformation, but at least the three of us are into that. We get to understand how it has affected healthcare in a way, or in such an approach. The next picture I'm going to show you is a very typical picture
Mhm.
of a hospital in the Philippines.
Yes.
Oh,
I
but and
bet this picture is a non-COVID season, and yet it looks really, cramped. This is, I agree, this is a
Yeah.
typical picture
This
of our
this bring
hospital.
this brings me back memory lane. Like
Yeah, yeah.
when my youngest brother was born, our youngest brother was born. So this was the situation. We were waiting in the emergency room for quite a while, like almost half a day, and I have seen literally, patients come and go, 2 3 deaths while we were in there while waiting for our room. And
Mm-hmm.
so
Mm-hmm.
yes, go ahead.
And yeah, wait, I just want to add, I'm very familiar with this too because I guess I could say ever since I started become a teacher, ever since I started working, my role in the family was to make sure that whenever my father had a stroke, which by the way he had 7 strokes until it
oh
was
man,
really his time to go, I every other year I was in the hospital. Anne Marie was with me, Louis was with me, and I can only, I could, do a separate, live streaming on how difficult was our experience, because every time my father needed blood, I had to ask one of my students at Cebu Normal University to help me. And since they needed money too, they said yes. And that's how it was. I never had to go to like a portal and just ask help from there. Rather, I was personally asking people, would you be willing to donate blood? My father really need it. I can pay you 500 for that. And of course they needed money too, so that's how it was for me and my family.
So,
Yeah.
I think what it signifies is more of, I think everyone, whether we would like it or not, is affected as to how disorganized was. I'm not saying that it is not now.
Mm-hmm.
Healthcare service is in the Philippines,
Yeah.
and you're
And
right.
it's so hard to explain. Even with my husband, it's so hard for him to understand that kind of situation if you have never been in there. He still
Yeah.
Mm-hmm.
questions me, why do you need to send money every time somebody is sick in the Philippines?
Oh, you
You
just
just
don't know how expensive it is here to get sick.
you just don't know, because we don't even one, that's another topic, is insurance. We don't have that insurance because we are not willing to pay thousands every month to take that out of our budget to put for insurance that we don't know if we're gonna get sick or not, or let's anyways, moving on. Ang dami kasi facet ng
I'm I'm
healthcare.
I'm
um,
very, very, how would I say this? I'm very pumped up whenever I talk about
oh yeah.
healthcare industry, because it doesn't touch one industry, it touches everything. You talk about
Yes,
policy, you talk about social political issues, you're
yes.
talking about, but what is, I mean, sorry if I'm cutting myself and I'm censoring myself, but I think what is very hitting close to home for us is that it affects everyone because it affects
Mm-hmm.
the very life of us. And this picture is actually, you're right, Miss O. This is the pre-COVID time, and this was
Mm-hmm.
actually at the a certain hospital in Manila. I would not name it, but I actually
Mm-hmm.
used this picture when I did the presentation in Seoul, Korea. Uh, what is actually very apparent here is that how we look at the people on white robe as gods, right? It's more of when we are at the ER or when we are at the ward, we would always
Multiverse.
think of, when will my doctor visit me? We're under the
Mm-hmm.
mercy of the doctor because we don't even know what's going on. We don't even know why are we taking the medication, because we don't take it within ourselves to ask questions. And that basically has changed because of the digital transformation. Right now, whether people would like it or not, a lot of people who would be in the hospital would have now a chance to ask questions as to, why am I taking this? Because
Mm-hmm.
even before asking a doctor, the first thing that you do is you Google your medicine. Why
Mm-hmm.
is my doctor giving me this? I'm feeling this way, and my doctor has given me this kind of generic. So these kind of things were actually playing a vital role in reforming the healthcare industry. The adoption of digital healthcare solutions, including the electronic health record in emerging markets, I'm reading it na lang, could change dramatically in the next few years. And this was pre-COVID. With the internet and smartphone penetration growing and the technology infrastructure moving to cloud-based services, this presents the opportunity to develop innovative and cost-effective solutions to deliver healthcare services. These new digital healthcare models involve rapid prototyping, designing, and implementation, which presents a great opportunity for emerging markets to leapfrog the developed markets. Meaning, um, if you go back here, coming from the systems perspective of a software development guy, we are not looking at a problem. We're looking at a great opportunity to create systems. And then
Yes.
another opportunity also to, there is going to be a lot of treasure of data, and that could automatically be converted into an information that could now produce to another set of product, or could actually change how we do healthcare in the Philippines.
Mm-hmm.
And that basically is coming into the light right now of the young, I would definitely say young kids like me, in terms of how can we now add value to healthcare as an industry.
Mm-hmm.
Now,
Mm-hmm.
um, all of what I have said, and even um, the how do I say this? The figure that I'm showing right now is coming from the PricewaterhouseCooper white paper that was published in 2017. As I've mentioned, it was entitled "The Digital Healthcare Leap." So, how we're doing now the things in the Philippines is that we're doing everything on paper records. I don't know if Miss O and Anne, during the time that helping your folks or your
Yeah.
grandparents or your parents, automatically before even the doctor would talk to you and discuss about their
Mm-hmm.
illnesses, the doctors would end up reading first the paper in front of them,
Yeah.
Right.
and
Yes. Mm-hmm.
that's the time that they're going to say, ah, yeah. Honestly speaking, in that 15, I told you about the 15-minute time earlier, and then the three
Mm-hmm.
hours time that you're waiting, because it was an average time of a patient to a doctor that was also presented by PricewaterhouseCooper. And of that 15 minutes, 10 minutes are actually for the doctor to review your past progress notes, and only
Mm-hmm.
5 minutes in telling you that, yeah, you're feeling it this way now, so we're going to do this medicine, without even
Mm-hmm.
explaining to you that we have to intervene the way you're feeling right now by administering this kind of medicine. We're not getting into that kind of engagement, that the best way for a care to really be given effectively is for the patient to be educated. But that kind of education basically is being lost to, one, the ratio of medical care professionals to the number of patients. Second, the intact record of your past history or your medical cases. And that basically is something that we're trying to close the gap.
Mm-hmm.
So basically now, from paper-based health solutions, we are now going into the Philippines is actually on the second one. We're trying to do a digital version of the patient informations. The trying to, like, when you go to a hospital before, it's all about paper. They write a paper, then you use that paper. You go to the doctor, then the doctor will be using the paper. Right now,
John
everything.
Dave, are you just talking on the? Just I'm sorry to cut you off, but right now that is I am echoing again. But right now, that is you said that's happening in most hospitals,
It is
or
happening right
all,
now.
or some, or the high and prestigious 5-star hospitals only.
No, actually, it's happening right now because the Philippine Health Insurance Company, or PhilHealth, which
Okay.
is like our Medicare, is requiring now all hospitals, before they are being paid by the insurance claims,
Mm-hmm.
to process an electronic claim. So they are
Okay,
obliged now by the government to do that. But
that is
in
good.
terms of effectively doing it, that is a big question mark.
That's another
Yeah.
topic.
I
Yeah.
wanna go in right at this moment because just when you were talking about it, remember that JB and I were just in the ER here, and it was really our first time to be in the ER here in the
Mm.
US. So I was sitting down, and I can tell you this: it was a totally different experience because there are more staff here. So while you were talking and you were saying that the doctor actually only spent 5 minutes to tell the patient in the Philippines kung naunsa na sila, tinuod na siya. Kay ang hitabo manggod, gamay ra kaayong staff ang hospital. I did not see, these are the people that I did not see ha sa Pilipinas while my father was in the hospital. Wala may kuan, physician's assistant. Kay supposedly,
Yes.
ang physician's assistant will read what happened to what is going on with the patient. They would read that to the doctor, and then the doctor, this is what happened during JB's time, the physician's assistant was really the one attending to JB. It wasn't the doctor. The doctor was just, oh, you did this, you did this, you did this. Okay, this is what I'm going to say to the patient now. So what I see here, John Dave, before this can we can really be successful, there should be job creation. So wala na magreklamo sa Pilipinas nga wala sila trabaho. Ang ilarang buhaton mangiskwela para makatrabaho sa hospital as encoders, medical encoders, nurse ITs, nurse education, so many things. Murag daghang kitag layuton ani. So, yes, affirmative. Nindot ni siya
Yes,
nga
but
topic.
yes,
Ah,
that's a lot. Again, that's a lot of stuff that we can discuss, but I am
Yeah.
just glad that we are starting, we are starting from something, and hopefully we can move fast enough to bridge the gap that we have
Yeah.
mentioned earlier.
And I think I would want to add also to I would want to piggyback on what Miss O mentioned about a lot of needed job creation. To be honest, Miss Olive, one of the criteria also that I got my it's and not the criteria, but a new wisdom that I was able to capture when we were having the Harvard Business School discussion on healthcare delivery. It's more on the ego also of doctors back in the Philippines. Um, Nurses are considered as really the hands, the eyes, and the ears of doctors in the US. Whatever the nurses or the physician's assistants would
mhm.
feed the doctors, they take it by face value.
Mhm.
In the Philippines, the doctor would tell the nurses, I'm the doctor, you follow me. And that
Uh-huh.
basically has to also change. So there's a kind of
Mhm.
culture that we have to change, that the machismo of that title is not going to function really well if you are not going to appreciate that even in healthcare delivery, it is a team. I mean, a surgeon
Yes.
could just,
It's a
That
team.
is so hard. You're asking for too much, Jen Dave. You know that we're going back to
I would
culture
agree.
again, and it's not even just in the medical field. That's all over. It's a kind of hush all over the world
Yeah.
because that's an
Could you
all field.
imagine the
That's an
doctor had
all
to finish a
field. So
lot of,
that's
yeah.
oh my goodness, yes. But we can start from somewhere.
yeah, I
That's
know.
even
So
in the
anyway,
education profession. That's also part of it. Wherever
yeah.
in an office system well, we're Philippines. Sa Pilipinas lang nakikita. Only in the Philippines. All
Yeah.
right. So, but I mean,
But
we're starting off
anyway,
somewhere. Yep.
Pero,
yeah,
pero John Dave, yeah, let's
yeah.
pursue that. What was the wisdom that we have to change, and was there
We have to.
anything else
It's
that you
really more of
realized?
it's more of we have to reform the way we look at doctors. They're not gods. They're also human being that would be very dependent on the functionalities of their
Mhm.
ancillaries, like their even in surgery ha. Og sayop ang pagka sterilize sa
Yes.
gamit. Oh my God,
Mhm.
it's going to be an
Mhm.
infection.
And
But
Yeah.
that would go on other way around also. If something has to happen, you're right, and we're gonna blame it all to the doctor and say
doctors,
Doctor.
our fault, and
exactly,
then we strip off his, everything that he has,
imagine.
like tangtangan dayon og lisensya and all that. Again, they're just
Mhm.
human beings. You're right, and we need to
Yes.
Yeah.
change that kind of like
And
yes,
Yeah.
it was actually more of a wisdom in a way that would make you think that in any profession di ay, in any field, there is no such thing as a one man show. It's always going
Mm.
to be having those
A
people behind.
team. I agree.
So I would want to
Mhm.
shout out to Ram with how he's also been supporting with all of this. So going back lang to the picture that I'm showing, one thing that we were looking at is to have that kind of leap in terms of if we will not do the traditional digital health model, which is what we're trying to perfect right now, is we're going to change it to the new digital health model, which is cloud based, open source. When we say open source, that means anybody who needed to access, if they have that kind of permission or clearance, they could access the data, and it's going to be integrated. It's going to be social and it's going to be mobile. The main thing though is that when we talk about cloud based, it's very dependent on IT infrastructure, which I think everybody would agree with me that we do not have the best internet bandwidth connection there is in the entire Southeast Asia. We are we
Mhm.
that's a different topic. Okay,
yeah.
that's a
If there's
different
we're Ann and Miss O, if there's one thing, we're number one in IT infrastructure.
oh
We're
yeah,
number one in cost.
cost.
We're
Ah,
number one in the most expensive. So anyway,
agree.
Okay,
so we're getting into that. We're looking at that in 2000 and if I'm not mistaken, 2016, during the time of the previous administration, they were thinking to create the Philippine Healthcare Information Exchange. Meaning, ako si John Dave, of course, I have my allergies, I have my blood type, I have my previous history, my health, or we call it the medical risk factors, meaning did I go through a surgery? Is my mom, susceptible to hypertension? Do we have anybody in the family that got cardiac arrest history? So basically, these are risk factors that genetically could have been cascaded down to me. So if I met an accident and then my doctor is not available and I am unconscious, nobody now will be able to identify as to what will be the medicine that could best work with me. Will I not react on aspirin, knowing that I have an
Correct.
allergy in aspirin? Will I
Mm-hmm.
not function um, if they have to do transfusion of blood to me?
Mm-hmm.
Did they get the correct blood type? Because of course there would be, it's more of a split second that would basically help the way they would apply or administer care for my case. So the Philippines, with a very foresight, noble vision, together with the Asian Development Bank, was actually thinking of the Philippine Information Exchange for healthcare. So that's why we're trying to create all the electronic clinical records of everyone, in terms of they would be able to tap it, in terms of who will be able to be given access. That would be a different topic. And then how they're going to access it, again, that would be again a different topic. But that was actually the aim. But when they were asking me in one of the conferences, I was saying that I think even before going towards noon, the digital health model, I think we have to first discuss as to how we're going to improve our internet, how we're going to improve, um, telecommunications in the Philippines, because that would basically become the backbone of this entire project or the entire noble vision. And yeah, again, that's going to be another topic.
Yes, please. Do we
How
have any resource person for that so we can discuss that also? That will put that in writing so we can take a look at anybody that could help us out with that. Yes, just a discussion. Everything starts with a discussion, and
yeah.
then we can tap at people like, oh, they are already doing that. You're discussing it right now, but they're already doing that.
Mm-hmm.
But we need to know, like,
Yeah.
how can we help? Like, thank you, Jande, for opening that one up. So go ahead.
Okay, so what I'm trying to show you right now is on your left, is a paper-based, the traditional way of doing the electronic health records, and the one on your right is actually the concept of new digital health model. Okay, let's first talk about the traditional digital health model. When we're talking about the traditional, uh, let's take, for instance, one case of an antibiotic resistant pneumonia. So
Mm-hmm.
basically, that means he was given first line, second line, third line of antibiotics, but the pneumonia will not go down, or they would not be able to cure the pneumonia. Meaning the bacteria that is in his lungs automatically grew resistant to the antibiotics. Normally, what happens is that if you have the record that you are antibiotic resistant, your specialist, your infection specialist, will not give you that kind of strain of antibiotics. What they'll do is they would now go to the third or the fourth line of antibiotics, because they knew already that you were able to develop resistance on antibiotics. So again, in healthcare, time is of the essence. So we're talking about especially on the immunocompromised people, those that got human immunodeficiency, and then the aged people, the 20% discount, senior citizens. So basically,
Yeah,
for them, it's more like when you give them medicine, it has to automatically be targeted to the infection. They
right.
would
Mm-hmm.
not, the doctors will not have now the luxury of time to do trial and error. So it becomes now a very critical point that On the new digital health model, if I am a patient, when I go to my doctor and say, like, I've been having this cough for the last 2 weeks, the doctors could automatically look at, okay, the last time you were here, you developed pneumonia and you were having this antibiotic resistance. So we could now start with a new set of antibiotics the moment that we would be able to identify that you have pneumonia. There's a story there also that, and I have learned this because of my exposure working closely with doctors and medical care professionals. The antibiotics, if you have an infection, if you take that antibiotic now, in the next 3 months, you're not supposed to take that kind of strain of antibiotic.
I did not know that.
You are not supposed to take that, like for instance, azithromycin. If you took
Mhm.
azithromycin now to deal with your pneumonia, then after a month, you were okay. But on your second month, you develop pneumonia again. You're not supposed to be given azithromycin because you are within the window of the 3-month period. Because if within 3 months you'll be given azithromycin, there is a tendency that the bacteria within your system will
Uh-huh.
not react to azithromycin and instead will now look at the strain of azithromycin and then would create their own defense mechanism for that antibiotic.
Yeah.
So think of it this way. If I am a patient from other hospital, I got into,
Mm-hmm.
an infection. I went to another hospital and then they did not have any idea that there was an antibiotic that
Right.
was given to you.
Right.
Oh man.
So
Yes.
this kind of data is very critical and crucial in
Yes.
administering healthcare. Second,
True.
also in the traditional healthcare model is that we are very physician centric. If the doctor would say jump with no questions asked, I'm just going to jump.
Oh.
Mhm.
On the new digital health model, it is more centered into educating the patient, so it's more patient centric. And that's one thing I have learned. Again, I'm sorry if I would be bragging about the Harvard Business School. With Michael Porter, he says that if there's one condition, the traditional way of looking at it is we're looking at it in a very siloed approach. For instance, cancer. We're looking, if the doctor would say, the oncologist would say, we're going to start with chemotherapy. The
Mm-hmm.
patient automatically will not be given any option but to start with chemotherapy. In the way we do things in the new normal, it should be an
Mm-hmm.
integrated practice unit that basically you are not just going to start with chemotherapy, but you're going to give options to the patient. And then at the same time, you have to create that support mechanism. So
Mhm.
if this medicine, for instance, that you'd start with chemotherapy would cause you depression, then automatically your oncologist would have to tell you, okay, we have to call in a psychiatrist to work with me
Mm-hmm.
in supervising. So it becomes an integrated approach. So now it's not focused with the doctor, it is now very focused on patient. So it's not more of how one doctor would tell you that this is the best way to go, but instead it's
Mm-hmm.
going to be now, okay, I
An
am not
option.
good in this criteria or this area, then I'd have to ask another friend of mine or another colleague that will be working with me. But one area though that we're looking at that is more of how the cost will now increase
Mm-hmm.
because you're not just going to be talking about one specialist. You'll be talking with a handful of specialists. But that basically changes the way we do things because you now get some more options. You get to be educated. You get to more understand and comprehend the way how it should be. And if not another specialist, the doctor will have to say, okay, we have to start family counseling or have, a family meeting that these are the things that he's going to experience because we're going to start chemotherapy and the support from the family will have to be required. And these are the things that are missing in the Philippine healthcare system because we were running out of time.
Right. So, yeah, thank you so much for that, John Dave. That just opened my eyes, actually. I already know that an experience, sorry, but most of those stuff here in America. And again, it's so hard for me to explain that in my family member that it should have been expected for us to be treated good also in the Philippines. Like I have like little kids and we have been in the doctors, and even if it's just an emergency, you're right, they whatever they will have in the emergency room, it would be forwarded to our primary care physician, so they have a record of everything.
Mhm.
So my kids are allergic to this kind of antibiotics. They could trace what are those antibiotics that were given to them. Oh, so hindi pa nila na try to, eto, let's try this one. So it's a better way of taking
Mhm.
care, you know. But it's also making me happy that we are on that trend of in that direction right now. It might be slow for, other places. You're right, we're gonna start from somewhere. There's a lot of challenges for that, but at least we know that we are starting from somewhere. So the next time I go home in the Philippines, and I'll say, which doctor or which hospital has this new digital health model, so I can just go there and make sure that all our records are intact. Because you don't know, really, honestly, one of the things that scares my husband every time we go home in the Philippines is, what if you get sick in there?
Yeah.
Oh, Delaney and Alec were sick, like a few, like, of course, with the temperature and all that. But then, do we have somebody that would keep our record, that could forward our record possibly when we get back in here, and would say, oh, what were the medicine given to you when you were sick in the Philippines? So hopefully that kind of connection, since it would be in the cloud, pwede na siyang mapasa, ganyan.
Yes.
So hopefully we are really, really hoping that it would be widely spread, and hopefully, it would, again, there's a lot of challenges. But where are we, Zande? Where are we in terms of that?
Um.
What is our statistics? How many have you presented this into, and where are we?
Okay. In terms of the product, right now what we have developed with my team is the first fully integrated system in the Philippines. So that's why actually the likes of Globe got into an agreement with us that they're reselling the product, because we have seen the value as to how it should be in terms of data gathering and data sharing. The
Mhm,
third factor actually, Anne, and I would answer the statistics later on. The third
mhm,
factor is on independent. Before, it's very siloed.
mhm,
You can't get into it until your doctor would say, like, yeah, I would share it to you. But right now, the new digital model is more of, I'd have to have the data so that I could integrate it with all of the specialists that I would want to get a second opinion from.
mhm.
And the fourth one is actually more of, we're not just going to discuss security, but we're going to talk about trust. That
True.
means I trust my primary care provider, or maybe my family doctor,
Right.
that however my data will be inside, I'd be given access, and that whatever progress notes that he's giving is
Mhm,
going to be shared to some of the doctors, or some of the specialists that I would want to work with.
mhm.
And that is basically, these are actually the healthcare models that we're trying to look at in such a way na there's a big reform that we have to identify and we have to value. Um, One area that I think I'd have to highlight before I would move forward is more of, the difference of healthcare data and healthcare information, right?
Right.
So healthcare data, we own that. We as patients, we own that.
Right.
But if these data are processed, or these are converted into information, meaning there is analysis already, there is a
Mhm.
healthcare plan that was identified, the funny thing is we don't own that anymore.
Yeah, and that's
The
why
health,
we do our signature, that they can do anything about the information. And like I told you, John Dave, like when we were talking at the ski resort, that has always been my concern. Even here in the United States, I don't feel comfortable that these people have access to my insides. Like, you know what I mean? I
yes,
trust the doctor, I trust the people, but what about the system? The one that you do in hybrid, are we secure? What if we're gonna be hacked? Who's gonna get this information and then target us individuals? That's really scary, I should tell you that. It's very
okay, first,
scary.
yeah. 2018, there was a big story that blew out of that went out of proportion. We know how Singapore is in terms of security of the data. Would you even believe that the Singapore healthcare system that houses millions of data, even the data of their prime minister was hacked? And it was very scary because that is Singapore. Singapore is one of the top countries when we talk about security in terms of cybersecurity, but they were hacked. So
Mm-hmm.
meaning, um, whether we like it or not, it could always fall on the wrong hands of the people. But what we could value then is more of how do we now consider the trust factor, and how do we make sure that whatever we have is well taken care of. Well, one, and this is going to answer the question earlier in terms of will it be possible that the data that we have here can be now, shared to the data. We call it the data center in the US. We call
Mm.
it the HL7 standard, meaning there is a standard in terms of keeping the records or formatting the records. That's the HL7. That's a healthcare standard that was actually identified by the HIPAA law
Mhm.
that we are also following right now in the Philippines. So it becomes interoperable, that these data, the data that we have here, can be now captured by the data of the systems in the US.
Okay.
What is very scary though is that, think of one steel cabinet. Ang galing ng reference ko,
Mm-hmm.
steel cabinet.
You're outdating
Parang
yourself.
so much of our age. One steel cabinet that if it is not locked or there is no
Mm-hmm.
right permission order, anybody could just go there and pick out the data.
Yeah, yun. Yeah.
Right.
And these are the kind of law that the HIPAA law, like the one in the US, is capturing, because that's very
Mm-hmm.
focused on healthcare data. That's also the same law that was used by the GPHR in Europe, that actually made a big problem for Google and Facebook when they changed their data. And in the Philippines, I'm very much happy to say that in the year 2017 or 2012, no, I think it started in 2012. They had the Privacy Commission established, but it was only enacted in 2016. I do not quote me on the dates. I might have messed it up, but at least right now we're following the GPHR function of Europe in terms of data privacy.
Okay.
So I would want to show to you the view of. So now we understood it, diba? We have the digital transformation, we have the healthcare, we have the problem, we have the big issue in terms of how do we look at it. But I would want to show you. I'm not trying to promote Cisco, but this is done by Cisco, and it is just talking about what is now the future of healthcare when we're doing digital healthcare. And I'm just
Okay.
going to play it.
What does the future hold for healthcare? In 5 years? 10? How will patients experience care, and how will clinicians deliver it? And what role will security and IT operations play in keeping critical functions online and secure? Today, the Internet of Things, IoT, is improving access to quality care and reducing costs by tracking equipment, patients, and staff, plus much more. We've just begun to scratch the surface. The possibilities are endless. Extending healthcare to the home is already making it possible to collect data and track wellness, which is changing the management of chronic pain and disease. Soon, this data will be integrated seamlessly into electronic health records so doctors can remotely monitor patients in real time. And it will be more and more common to meet with your doctor from home through telemedicine. Augmented reality, which uses digital images superimposed on live content, and virtual reality, an artificial 3D environment, are some of the hottest technologies today. In healthcare, they can be used to treat addiction, phobias, and PTSD, as well as to help doctors learn about anatomy and test surgical techniques. Artificial intelligence, or AI, is the ability for computerized machines to mimic human thought processes. AI, combined with natural language processing, could provide clinical decision support, such as automated symptom triage. In the future, AI could break through boundaries in ways we can't even conceive of right now. Robotics, already used in medicine for transportation, pharmacy automation, surgery assistance, and more, is becoming an essential part of our future. With Wi Fi 6 and real time haptic feedback, doctors could perform surgery enhanced by AI. Everything you do today and tomorrow, from deploying telemedicine services to implementing AI for clinical decision support, depends on a strong IT infrastructure. All your systems, network, mobility, collaboration, security, and data center need to work together seamlessly to support the changing face of medicine. And Cisco can help.
There you go. So basically, again, I'm not promoting Cisco, but I'm gonna stop now sharing my screen. So that basically it. When you talk about digital healthcare, it is something that, whether we like it or not, we have actually stepped on the accelerator pedal, that we had to adapt to it, and that basically have changed everything, that how we've been doing it. Even the way Pfizer developed the COVID-19 vaccine, they were using the genome practicing. And I remember I
Mm-hmm.
attended a conference in Canada, that before, when you talk about new medicine that will have to be introduced in the market, you'd have to go through series of testings. But right now, because of the genome sequencing, it would save us more time, and it'll take us shorter time to develop a medicine for a certain illness or a certain condition. So yeah, so I think that's what I would want to share to everyone, that healthcare is not something that we have to shy away from.
Yes.
Healthcare is affecting everyone, and whether we like it or not, digital transformation is touching
It's
healthcare already.
happening.
Yes.
Mm-hmm.
And we would
Mm-hmm.
not have to be shy away from it, but instead we have to embrace it, because the way that we have to embrace it is an embrace in terms of educating ourselves of what are the pros and cons. And once we educate ourselves, we know how to safeguard ourselves also for the consequences of it. So that's
Yes.
it.
Yeah.
I hope I did not bore you guys.
Great. Thank you so much, John Dave. I know I have told our viewers that if you have questions, comment it down below. We're going to take a couple of minutes to answer that. But I just want to thank John Dave for the wonderful presentation, for inspiring us, for making us question, and also what could we do, and if that's happening, are we open, like, oh, would my information be shared and all that, or looking for places or hospitals that has those kind of technology and updated resources. So Miss Olive, also thank you for joining us. If you have any more questions and comments, go ahead. John Dave is still right here. He still has 7 days of quarantine time, so we can really get him as a resource for 7 days, because I know he would be very busy when he's released out in the
Okay. So thank you, Anne, for allowing me to, take this opportunity to also say, I was about to ask John Dave, is this an optional future or this is going to happen? And he already said it, guys. This is going to happen whether we like it or not. So here we go. Since everyone in the Philippines will be pushed into this kind of future, I want you guys to make a comment, leave a comment, leave a question for John Dave. This is an opportunity to discuss the future because it's true. Many of us are going to be pushed into a future that we might not be agreeable. If you ask me, what Cisco was showing was very enticing. Wow, AI, yay! But no, I'm an old soul. I don't buy it. I don't like it. Okay? I'm not going to have any AI probing me. Okay? So if I can help it, God help me, crossing my fingers, in my old age when when I'm unable to make decisions for myself, when I will be in the hospital bed, if I can have that, remember, John Dave, you said that counseling would also be an option. Not everyone had to undergo surgery. Not everyone has to take medication. Not everyone has to take chemotherapy. Okay, I would really love for our healthcare system to give its patients a chance to, like you said, create a path for their health. I like that. In the same manner that people would say, this is the kind of exercise regime I want to follow, then let that person go that way. And this is the kind of food I want to eat. I want to be vegetarian, then go vegetarian. In healthcare system, I want options. So you want to do chemo for your cancer? Do that path. You want to go traditional herbal? Go do that path. I want that kind of option. So I hope it will be embedded in that future, because to be just pushed into having machines probing me, having my information go elsewhere, I can't. Okay, that's not me. I'm like an old school again. So, and which actually the reason why I have encouraged JB to take up applied technology engineering. He will be part of that. And hopefully in his future, because he's the youth of today, he would explain that to me. And when he explains that to me, I will always find opportunities to create a path for those who don't want it. Because I guess we, as the alumni at Rizal Youth Leadership Institute, and we have been through this path before when we were younger, we are always the kind of people who seek for options. And I'm very happy and proud, John Dave, that you have found a solution to the current problem in the Philippines. And I believe that with more people joining us, especially leaving comments, giving us more brilliant ideas, we can find other solutions too. So if you guys are viewing this right now, together with you guys, even if you're not ready, this is your future. We would like to thank Anne Marie for hosting this opportunity for us to open our mind, for John Day for letting us know what's in store for all of us. You have no option. Remember that. You're going to be shoved into this healthcare system, okay? And for any healthcare provider in the Philippines right now who'd like to make a comment, please let us know what you think. For the youth of today, if you want to ask how your future is going to look like, nobody really knows, but we might be able to help you figure that out. Thank you so much, Anne Marie. Thank you, John Dave. And of course, to the people behind, Ramwen, thank you so much. You are our tech guy together with Anne. So that's it for
So
me. Thank
much.
you.
Yes, thank you, Miss Olive. So we have Rachel, we have Grace also that's on the background. Thank you so much. And I know, so that's one thing that we really like with our Rizal talk. We can discuss things, we can agree to disagree, we can see what's new. I mean, what is new? Oh, there's something new. How can we help, what can we do, can we improve that? Oh, at least we can discuss things out. And I said, if you have comment, write it down, but it looks like people in the Philippines are sleeping right now. But that's also one thing that's opening the eyes also of the people that are looking and watching from the other countries and saying, oh, Philippines does not have this. And if you are business people, or I don't know if we can reach that kind of level, but at least we can also educate them. And my end, like on the side of my husband, at least he would know, like, oh, okay, all right. So things like that, just to open somebody's mind. And if we decide to act on it, that's great. And that's the challenge of our youth today, of our youth, the upcoming citizens of the Philippines and in the world. Just like John Dave, again, you inspired me a lot. You see a problem, you act on it, and I'm so proud that I know you.
Thank
Thank you
you.
so
Thank you.
much.
Thank you.
Any
Thank you.
last
Thank you.
words, John Dave? Promote your channel. No, just kidding. Promote your high. I
Hi,
know you
Bray.
mentioned a lot about hybrid, so I know you talk about your ideas and all. But again, John Dave in here is our. Oh, I took it out. Sorry, is the CEO of High Brain.
Yeah. I think it's more of a no. I think it's just more of I would want to tell the youth that
Oh,
before, and right, we have been like them also, that we were just trying to find a path for our greatness, if I may say. Never stop being curious of what's going on around you, and never stop to act on things that you could act on. Never be complacent. And always think that you have to adapt to change and you have to accept how things are, but it does not also negate that you could act on certain issues or certain factors in your life. So never lose sight of the end goal, and that is knowing that you could do something to make the community better than how it is. So I think that's just it.
Much again,
Thank
John
you, Miss O,
Dave.
for always instilling that
Thank you,
also in
thank
us.
you, thank you, thank you so much. And to our ARYLI team, thank you very much. I know we have a lot in store, and I know I was supposed to do a promotion here, but it looks like there's only 8 people. But the next activity that we will be having is our ARYLI Pledge 2. I feel like we were successful with what we did this morning with Miss Olive. Thank you so much for that. But our session 2 would be, I do not have it here, would be me. I will be teaching our session 2, and that would be on February. I don't have my date. But next Saturday, Philippine time, 10 o'clock in the morning. So the registration will be up, and we will be forwarding those and inviting those um, previous students that we have here. And hopefully, we will have others that will join us. Okay,
Yeah.
again, thank you so much. Any other words, Miss Olive?
I would like to say that this was a very successful pilot result talk. So if you are anyone out there, you want to reach out to us, you have some very pressing topics for our youth, yes, please talk to us and we can put you here live in our Facebook page so that we can inform the youth. The adults right now are changing the future, but the future will be received by the youth of today, and we need you guys to talk. Don't just we don't listen. We just don't want to hand a future to them that they might not like. So please join us in our result talk. Thank you so much, John Dave, for being our
No
first
problemo.
person in our result talk. Thank you, Anne Marie.
Thank you so much. Again, good evening, Philippines, and good
Good
morning.
night.
Good
And
Good
good morning to
night.
those of
Thank
night.
you.
you, thank you, thank you.
Bye
And I'll see you
bye.
next week. Bye bye. Thank you, Miss
Bye.
Olive. All right, you can stay for a little bit.
Welcome. You're welcome.